So, good afternoon, ma'am. My name is Meryl Joyce Colong. I am a second-year medical student from Davao Medical School Foundation. And today, I will be the one who will be doing the assessment or the examination of the cranial nerves. So, before we start, may I know your complete name?
Marity Colong,
Your age?
54 years old.
Your address?
Family Homes, Davao City.
Marital status?
I'm married.
Your occupation?
I'm a dentist.
And your religion?
Protestant.
Okay, so bale, for today's assessment or examination, we will be doing, checking or we will be assessing from cranial nerve 1 up to cranial nerve 12. Okay, I will be explaining the detailed procedures and the purpose as we go further with the examination. So, do you have any questions before we start?
Wala po.
So, shall we proceed na po?
Yes.
Okay, so first, we will be doing the cranial nerve 1 assessment. So, cranial nerve 1 is the olfactory nerve. So, in this test, I'm going to ask you to cover one nostril. Can you cover one nostril, please? Okay, and then try to smell.
It's coffee.
Okay, very good. Try to cover the other nostril, please.
Cinnamon.
Okay, very good. So next, we will be proceeding with the cranial nerve 2, which is the optic nerve. So for this one, we are going to assess the visual acuity. A while ago, we were assessing the sense of smell, but now we are going to assess the visual acuity. So as you can see there, we have a Snellen chart. Okay, and for this test, I'm going to ask you to cover one eye. Okay, we will do this one eye at a time, and then try to read the topmost letter going down up to the letter in which you can read. Okay. So before we start with this test, do you have any glasses?
Wala po.
Okay. So we will start with the right eye first. So cover your left eye, please. Okay. So try to read the topmost letter.
E.
Okay.
F. P. T. O. Z. L. P. E. D.
Okay.
P. E. C. F. T.
Okay.
E. D. F. C. Z. P.
Okay.
F. E. L. O. P. Z. D.
Okay.
E. F. P. O. T. E. Z.
Okay. Very good. So try doing it on the other eye.
E. F. P. T. O. Z. L. P. E. D. P. E. C. F. D. E. D. F. C. Z. P. F. P. L. O. P. Z. D. D. E. F. P. O. T. E. C.
Okay. Very good. So for the visual acuity, it is 20/20. Okay. So next, we will be assessing the cranial nerves 3, 4, and 6, which are the oculomotor, trochlear, and abducens nerve respectively. So in here, you're going to assess your extraocular movements of your eye muscle. Okay, so can you look? Can you follow my finger? Okay, I'm going for the right. Okay, so now I'm going to put it forward. Okay, very good. So, next we will proceed with the cranial nerve 5, which is the trigeminal nerve. So, in here, we will be doing 3 assessments. Now, first will be jaw assessment of the jaw movement. Next will be the facial sensation. And then, followed by the jaw movement, facial sensation, followed by the corneal reflex. Okay, so I will be palpating your temporal muscle first. Okay, will you please clench your teeth? Okay, very good. Could you please clench your teeth, please? Okay, so this one for temporal muscle, this one for the masseter. Okay, could you please open your mouth and then move your jaw side to side? Okay, very good. So next, we will be doing the assessment of the facial sensation. So I will be using this one, okay, and then tell me if you can feel dull or sharp. Okay, could you please close your eyes?
Dull. dull, sharp, 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 dull.
Okay. So next is the light touch sensation. So I will be touching it around your face and then tell me if you can feel the same touch. Okay? Close your eyes, please.
Same, 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 same.
Okay, very good. Then lastly would be the corneal reflex. Okay, so I'm going to check for any presence of reflex. Could you please look towards your right? Okay, very good. Towards your left, please. Okay, very good. So now we will proceed with the cranial nerve 7, which is the facial nerve. So in here, we are going to assess facial movements. Okay, so I'm going to ask you to raise your eyebrows. Okay, and then frown. Okay, and then try to close your eyes tightly. And then I will be assessing the strength of your eye muscle. Please try to resist. Okay, very good. Then next, could you please smile? Okay, could you please show me your teeth? Okay, very good. And then, could you please puff your cheeks? Okay, very good. So next, we will be assessing cranial nerve 8. So for this cranial nerve, we are checking for the sense of hearing. So could you please sit down? Okay. Okay, so for this test, I'm going to whisper words and letters while covering your non-testing ear. So I will be placing my finger in the tragus. Okay, and then I will start now.
3-5J.
Very good.
8-0.
Very good. Okay, so you may now go back here. Okay, so next would be the cranial nerve 9 and 10, which are the glossopharyngeal and the vagus nerve. So in here, we're going to assess for gag reflex, hoarseness of voice, and any abnormalities when it comes to swallowing and rising of the palate. Okay, so I'm going to wear my gloves. Okay, and then can you please open your mouth for me? Can you move forward your tongue? Okay, can you say ah? Can you say ah? Prolong ah, please. Okay. So there is symmetrical rise of the palate, and there is no deviation of the uvula. Okay, so now I will be inducing gag reflux. Could you please open your mouth? Okay, very good. So now, could you please try to swallow? Okay, did you have a difficulty of swallowing? Okay, very good. So next, we're going to assess the cranial nerve 11, which is the spinal accessory nerve. So in this cranial nerve, we're going to assess the strength or the movement of your shoulder as well as your neck. Okay, so try to raise your shoulder, shrug your shoulder. Okay, try to resist. Okay, very good. So could you please try to resist my hand? Okay, very good. Other side, please. Okay, so there is no atrophy, no fasciculations. There is contraction of the muscles. Okay, so next, okay, we're going to assess the last cranial nerve, which is cranial nerve 12, the hypoglossal nerve. Okay, so in this one, we're going to assess, no, your tongue position, movement, and any possible deviation. Okay, so could you please open your mouth? Okay, so there is no atrophy, there is no fasciculations. Okay, could you please bring out your tongue? Okay, no atrophy, no deviation, and it is centrally placed. Okay? So, to summarize our examination, no, for cranial nerve 1, you can perceive both odors, which is a normal findings. Second is for the cranial nerve 2, which is the optic nerve, you have a good visual acuity, which is 20/20. Okay, and then for the cranial nerves 3, 4, and 6, okay, there is no any abnormalities when it comes to the movement of the extraocular muscles. And then for cranial nerve 5, the trigeminal nerve, okay, there is normal strength, no, when it comes to jaw movements. And then for the facial sensation, okay, facial sensation normal din po. And then for the corneal reflex, there is presence of reflex. Okay, then as for the cranial nerve 7, which is the facial nerve, there is no abnormal movements. Okay, so far lahat naman po ng movements na nagawa po ninyo. Okay, there is also a good strength, no, of your eye muscles. Then as for the cranial nerve 8, which is the vestibulocochlear nerve, okay, you have a good sense of hearing. And then for the cranial nerves 9 and 10, okay, there is reflex, there is gall reflex, there is symmetrical rising of the palate, no deviation of the uvula. And as for the cranial nerve 11, the spinal accessory nerve, no, there is no atrophy of the muscles, no fasciculations, there is contraction of the sternocleidomastoid muscle. And as for the cranial nerve 12, hypoglossal nerve, there is no deviation of the tongue, and there is no atrophy and fasciculations as well. Okay, so far, lahat naman po normal. So, do you have any questions?
Wala po.
Okay, so thank you so much and have a great day.